Welcome to another edition of EdTalks. We're going to tackle a super tough topic, I think, but Jason, you might not think it's that tough. And maybe after our time together, I won't either. But I want to introduce everyone to Jason Lesandrini. Jason, welcome to EdTalks.
Thanks, Ed. I appreciate you having me.
And Jason, I'm going to try this word. You have a PhD or doctor, and you are an ethicist.
An
So
ethicist. That's correct.
yes.
Yeah, that's exactly right. Yeah. So I work in the space of ethics across industries.
Yeah, I just wanted to try that word. It's a tough word for me for some reason. But yeah, we connected because we were on a panel together. And I love the whole angle because I don't have a lot of experience in it and I need to understand it better. And I know my audience probably in the same boat as I am. So feel free, introduce yourself. And then I've got a couple questions for you.
Yeah, sounds great. So I'm Jason Lesandrini. I'm the Assistant Vice President for Ethics for Wellstar Health System. I also have under my purview, I do advanced care planning, spiritual health, language access. But basically, my job is I do ethics for the organization and I've worked with others outside to think about sort of complex ethical things that come up. And that, as you know, AI is one of these big ones these days. So
Yeah, no, and I loved everything you had to say on the panel. I was really impressed with your thoughts. And again, that's why I'm thrilled to have you here. So let's start at a high level and then I want to go a little deeper. What should people be thinking about? Broad topic, AI and ethics. Tell me how those two intersect.
yeah. Yeah. It's a great question. A couple thoughts come to mind. So I know this is the worst way to answer a question, but it's to tell people what they shouldn't be thinking about.
Yeah,
And so
right.
I think what I'm going to do is do that. I'm going to do the worst way to answer the question. So I think when I think about AI and ethics, we tend to see people thinking about things like bias and fairness and transparency and those things. And that's great. Those are wonderful things. But I think what ends up happening is when we focus on those types of things, we don't actually get to the root of what ethics and AI should be involved in and how we should
Yeah.
think about it. And partly that's because if you ask me, I think we think about ethics and lump it in this compliance box, right? At a lot of organizations. So it becomes ethics and compliance. And but I think there are lots of really great compliance people out there that are touching in this ethics space. But I think more often than not, what I see is it becomes another sort of checkbox to make sure we're adhering to some rules or regs rather than thinking broadly about what values or principles are at play, what stakeholders are involved, and sort of how we think about that. And so I think what we see in AI and ethics across the country is really a 30,000-foot view of people giving these abstract concepts of fairness, transparency, pick any privacy, whichever ones you want, but really nothing to do with the day-to-day work of thinking about and evaluating how AI and ethics overlap. And so I know that's a little nebulous and maybe saying not what to do, but that's kind of how I've been thinking about it the past few days.
No, I love that because you're right. Typically, we just think about a bunch of rules and we do the checkbox, but it's much more nuanced than that. It's much more strategic than that. So I love that approach. So Jason, you're at a sophisticated health system, and some of our audience also at sophisticated health system have someone like you. But I'm going to guess maybe 80% of hospitals don't have someone like you. And they're just now, they're just trying to figure out AI governance, things like that. What are maybe one or two steps, if you were coming in and sort of consulting, giving advice to them, what are one or two steps they should take when it comes to ethics as they start their journey down with AI?
Yeah, good question, Ed. I'm going to think about it in terms of process and content. That's maybe the best way I think about it. So, process wise, I think the first part of it is really just starting to think about it. The lack of people thinking about this, they say, oh, yeah, AI and ethics, it's important. And then they put it on a shelf and whatever. But I think a little bit about in different phases of how we're adapting and thinking about AI in organizations. So, I would ask governance structures to think about it before they put it in place, while it's in place, and then thinking about it afterwards. Now, what they're thinking about is going to depend, of course, on whatever the tool is that's being used and adapted, and whether it's patient facing, not patient facing. But I think there are some general concrete things that we can start with. So the first thing is just really a broad question about like, what do we think it's the right thing to do for the stakeholders who are involved in this? And that's not getting specific enough, Ed, but at least raises a moral awareness amongst the group at the table who's considering it to think that ethics actually stands on the same footing as all the other things that we're thinking about when we're thinking about implementing AI. And I know this may be a little base for a lot of folks in my field, but I think about it in terms of, some of the core values or principles we might think about in healthcare or actually broader than healthcare, to be honest, about, thinking about, we could ask questions like, what benefits do we think this this tool is actually bringing? Who are the benefits going to be brought to? What risk? Risk isn't maybe the right word. What harms do we think this tool could actually uh, create? And actually say the question and answer it. Don't just say, I don't think there are any.
Right.
Because the reality is that's just false. It's not true. There are always some type of harm. I mean, Ed, you know this in your career in healthcare. Listen, putting an IV in a patient's arm has burdens to it, right? We've done it a million times across every day. It happens. There are times when there are burdens that are, borne by patients. Air embolus, pick anything you want to pick. And so I think about those kinds of things. I think about other things that folks could start asking themselves is about, like, what is this? How is this impacting control and the ability, especially in a clinical facing, to enable a clinician to control the way medicine is practiced? How do we think about that? What impact does it have on the autonomy or authority of a clinician as they're doing this? Not that it would always be bad. Most of the times it's not. It's an enhancement actually to their autonomy. And then I think about, broad things about, and these are, of course, 10,000, maybe not 30,000, maybe we'll go down to like 10,000 or 5,000 foot view, thinking about how the benefits and burdens of implementing an AI tool might be shared amongst the community that we're trying to serve. So, we implement one that's app based, and that's a telephone thing. And so who has access to telephones? I think I shared this, we talked about this maybe on the webinar. Or it's going to be a call center based tool. Like, who is that going to tap? Who's more likely to call it? And is that going to put them at a disadvantage or give them benefits that maybe we should make sure we're considering across the wide spectrum of the enterprise?
Yeah, Jason, that's why I wanted to have you as a guest, because not only is this your area of expertise and you're super knowledgeable, but you're super pragmatic as well. Again, you're not, a lot of people are really great at theory, but can't execute. But obviously, what you're doing with your organization today, you know the theory, but you also know how to execute and be super pragmatic and collaborative. So thank you so much for sharing your wisdom with my audience on Ed Talks.
I appreciate it, Ed, and I'll take that last part as a significant comment. I will say I know a lot of folks in the field, and you're exactly right. It's all up here. It's never down here. I think the reality is there's patients and providers' lives that we're impacting, and we need to really think about them too. So thanks again.